A 3-year-old child, previously healthy, presents with persistent coughing, tachypnea, and exercise intolerance. His parents note he's had recurring respiratory symptoms since infancy, worsening over the last few months. On physical examination, he exhibits mild clubbing of the fingers and appears to be underweight for his age. A chest X-ray shows diffuse pulmonary infiltrates. On considering the presented symptoms and examination findings, what is the most probable diagnosis? A. Asthma. B. Cystic fibrosis. C. Diffuse lung disease, DLD. D. Congenital heart disease. The correct answer is C. Diffuse lung disease. This child's symptoms and radiographic findings suggest DLD, characterized by persistent respiratory symptoms and diffuse pulmonary infiltrates. DLDs affect the pulmonary parenchyma, leading to disrupted gas exchange and architectural changes in alveoli and airways. Further diagnostic testing, including a genetic workup and pulmonary function tests, is essential for confirming the diagnosis and identifying the specific subtype of DLD. Thanks for tuning in to our pediatric case review. For more case discussions and insights on pediatric conditions, don't forget to subscribe. See you next time.